Hello, I'm Dr. Frank Drummond, National Medical Director for Psychiatry at HCA Healthcare.
And I'm Amy Rushton, Vice President of Behavioral Health for HCA Healthcare.
In order to support our national crisis, it's imperative to maintain our healthcare services, including psychiatric services, at the highest possible level. We're here today to talk to you about dealing with it. What are these feelings that you're having during this crisis, and how do you maintain yourself and understand them? I'd like to talk about the first two that come to mind, as they're probably the most important. The first is anxiety. What is anxiety? Anxiety is your body's physical response to a mental situation. The anxiety that we're feeling is all kind of obvious. The fact that so many people are dying, that the world is changing so quickly. The symptoms of anxiety can include some things like shortness of breath and chest pain. Here's where things get a little tricky, right, Amy?
Definitely.
What are some of the symptoms of coronavirus?
Shortness of breath.
And chest tightness.
Yes.
Yeah, so these are very similar symptoms. So let's say you're anxious and you pick up an article reading about the current symptoms of coronavirus, and it's shortness of breath and chest pain. It's what you're having while you're reading this article. It's our job as healthcare professionals to kind of guide people through this process and help them understand what is their own personal anxiety and how can they manage, which Amy's going to talk about in a little bit, or what is a symptom of coronavirus and when should you go get checked.
And I think it's important to remind people about suggestion. So when you're reading an article and it says coronavirus, shortness of breath, your mind starts thinking about it, and that also increases your anxiety. And then all of a sudden you're short of breath and you're thinking about it and your chest is tight.
Correct. It's not uncommon in medical school for medical students to actually think they've developed 100 diseases in 1 year as they learn about them one by one. Same thing happens when you're learning about coronavirus, and this is everyone, not just doctors.
That's right.
And nurses. Another odd feeling that's kind of in the air and palpable everywhere is a certain air of sadness or detachment. And what I'd like to talk about is that this might be grief. Grief is qualified by 5 major stages. These stages can happen sequentially or all at the same time or partly with some and more with the others. But let's talk through them. The first stage is denial. Denial is very obvious during this epidemic and pandemic, in my opinion. The denial is, oh, it's not going to come to the US. It's not going to happen to me. It doesn't affect my age group. I don't have to take this seriously. I don't have to worry about anything except for toilet paper. This was everyone's first response to the virus, almost internationally. The second one is anger. I'm angry that this virus is happening. I'm angry that I don't understand. As a healthcare provider, sometimes you're angry that you don't have all the answers that people are looking to you to have. That can be very frustrating. And one of the first responses to that is become angry with yourself. Anger can be unhealthy if it goes on for too long. So let's talk about the other ones. There's the bargaining aspect. Well, if I self-isolate for 2 weeks, then I'll be fine. If I do this, then that'll happen. Or trying to negotiate your way through this in an irrational way. Next is sadness. Sadness is real. People are dying. People are stressed out. A lot of our friends in food and beverage are losing their jobs. So there's a lot of loss going on. That sadness, once again, is a natural response. It's also part of the collective grief of having to deal with this virus. The last phase is acceptance. And that's when you understand this thing is happening. It's causing all these reactions in me and all of those around me. And now I've got to figure out how I'm going to deal with this and how I'm going to help. I'm going to do a good job at work and at home and in my life to get through this to the other side. That's acceptance. That's what's important. Speaking of dealing with people, it's also sometimes a good idea to practice rational detachment. Rational detachment is what you do to protect your emotions by not taking others' behaviors personally. This rational detachment is a method of trying to understand that the person that you're speaking to at work or even at home also has 10 other things going on in their mind, including elderly parents who are probably exposed, children at home not getting a good enough school, other family members losing their job and they're probably going to need help, etc. So remember that everyone you interact with is just as stressed as you are about their own things. If you can, and if they come across as angry or upset or mad at you, a lot of times it's really just them trying to deal or the stress that's coming through in their interactions. If you practice rational detachment and get through that interaction, you'll get through the day a lot more peacefully. Now, Amy's going to talk to you about some other things to consider when self-management during this time.
Thanks, Dr. Drummond. First, it's important to identify the signs of stress that's occurring in your life. You may be constantly worrying about COVID-19 in the future, not sleeping, having nightmares, having difficulty communicating or listening, having difficulty giving or accepting help, decreased energy, not eating or overeating, using unhealthy coping strategies such as increase in alcohol or substance use. Many of these symptoms are signs of secondary trauma, also called compassion fatigue. Compassion fatigue can occur after exposure to one trauma or can be due to a cumulative level of exposure to trauma. I think that's really important for folks to understand. Everybody reacts very differently, and what might be big traumatic to me today, I could go into work the next day and see the same trauma, and it could affect me in a much different way.
Right. Trauma-informed care involves actually understanding that trauma is defined very individually. Every person's response or what they perceive as traumatic is different.
Right. And it's important to acknowledge and understand your own stress reactions. We're here to reassure you that any of these symptoms are common and natural, especially during times like we're in. We would also like to highlight concerns for overall general mental health while social distancing and being in isolation. Social distancing can lead to increases in depression, anxiety, and post-traumatic stress disorder. Another sensitive topic that we do want to highlight as well is being at home may not be the safest place for everyone. People are living in unsafe situations that involve domestic violence. And we really do encourage, if you're in that situation, to reach out, ask for help, or just keep connected to those that you trust.
It's during times like these when you see an increase in the amount of domestic abuse or violence. So when you are with patients and with coworkers, being sensitive to that, or even asking openly about it, if if there's a known history or there's someone that you're able to, and reach out and help them, just know that it's at a heightened amount at this point. Also, the rate of relapse for people that have problems with addiction. There might be lack of access to their normal 12-step groups, et cetera, or the same type of access that's so meaningful to them. So people are at high risk of relapse also during these times, and also the stress level and people sort of not knowing what to do. So any of your colleagues or friends or personally realize that risk is high and take those extra steps to support them or support yourself.
And it may be that that friend might ask to talk more. They may ask to even go for a walk. I think it's important to be open to when someone needs you, that might be their way of asking for help.
One thing I do personally is if I find that I'm wound up about having to talk about, say, coronavirus excessively, I just need to talk. And what I'll tell somebody is, okay, just give me 2 minutes. I'm venting, and then say what I need to say and paraphrase it and just kind of let the person know. But if I'm allowed to do that, I feel a lot better. And we should allow other people to do it too. It is very therapeutic.
Yes. So some important reminders for nurses and physicians that have been recommended by the American Psychiatric Nurses Association are: remember that you will have reactions to the increased stressors that you are encountering. We encourage you to have self-compassion. Remember, everyone will be impacted by the situation and will experience psychological distress on some level. It is okay to have some of these symptoms. It's easy to play up the importance of self-care to our patients while downplaying it in ourselves. Resist the urge. Try and eat right, exercise, and sleep. Develop a new habit, learn a new skill, FaceTime with friends, and stay connected. And I think ultimately you need to find what is going to help you relax in this situation. Dr. Drummond and I have found humor to be a great relief for us while we're working. So we really do encourage you to find whatever it is that helps you to relax. Look for it, hold on to it, and do it as much as you can. And remember, help is available if symptoms you are experiencing increase or they are negatively impacting your ability to provide care to your patients and your families.
At HCA Healthcare, we're doing everything we can to protect our staff and patients. We're working within CDC guidelines. It's important to keep behavioral health services and all services open as long as possible, as they are all essential healthcare services during this crisis. If you do find yourself in a personal crisis, remember to reach out to our EAP programs, of which there are multiple, and you can have some access to counseling to help get yourself through these difficult times.
I also think it's important to acknowledge and recognize that some people may even become suicidal during these times, and it's important to reach out to a suicide hotline or a crisis hotline.
I'd like to encourage everyone to stay positive, stay informed, and stay safe. Thank you so much for your time.